Welcome back to the OneUsmle Podcast, where we dive deep into critical medical topics. Today we're exploring a particularly urgent condition, esophageal perforation. Let's start with a case. Imagine you are in the emergency department when a 55-year-old man is rushed in. He's in severe pain, clutching his chest with pain radiating towards his back. He reports a history of intense vomiting after a large meal about 2 hours ago. Now he's feverish, his heart rate is elevated, and on auscultation, there's an unusual crunching sound in his chest. So what is the first step to confirm the diagnosis? Think about it, and we'll answer at the end of our discussion. Esophageal perforation is a severe medical emergency. The etiology includes instrumentation such as endoscopy, especially with interventions such as biopsies or cauterizations. Effort rupture, or Boerhaave Syndrome, is a spontaneous rupture resulting from violent retching. Esophagitis triggered by infections, certain medications, or corrosive substances. Patients typically present with severe chest or back pain, signs of systemic distress like fever and tachycardia, and specific symptoms such as subcutaneous emphysema or Hamman's sign, which is that crunching sound heard on auscultation. They might also have an atypical pleural effusion that could appear greenish due to bile contamination. To confirm esophageal perforation, key diagnostic steps include esophagography with water-soluble contrast, which is crucial for visualizing any leaks from the perforation. Imaging techniques, a chest X-ray or CT scan can show a widened mediastinum, pneumomediastinum, pneumothorax, and pleural effusion. Management of esophageal perforation involves several critical steps, NPO or nothing by mouth, to prevent further aggravation from oral intake, intravenous antibiotics and proton pump inhibitors to combat infection and reduce gastric acid secretion, emergent surgical consultation necessary for most cases to plan for operative debridement and repair, monitoring and supportive care. Continuous monitoring in a critical care setting is essential. Returning to our case, the best first step to confirm the diagnosis of an esophageal perforation is to perform an esophagography with water-soluble contrast. This technique is indispensable as it allows us to see if there's any leakage of the contrast, which would clearly indicate a perforation. Unlike barium, water-soluble contrast is safer in cases where it might leak into surrounding tissues, avoiding severe inflammatory reactions. That wraps up our discussion on esophageal perforation here at the OneUsmle Podcast. Always a challenging emergency, but with swift and precise intervention, outcomes can be significantly improved. Thanks for tuning in. If you found this episode enlightening, please like, share, and subscribe. And don't forget to visit our website for a free ebook that further explores this and other critical topics. Until next time, keep learning and stay sharp.